shortages are affecting personnel. Just quickly, I'm going to run through how the presentation is going to go. So first I'll go through my background and how I got to wanting to ask my question. I'll then go through my aims, my methods, how I conducted the research, my preliminary results, and my current emerging conclusions and evaluation. So within much of the public sector and with the working environment in general, it's recognised that mental health and wellbeing has a considerable effect on the performance and productivity of any organisation. Research within the military has unearthed that work strain and excessive workload has a statistically significant association with mental illnesses, including but not limited to substance use disorders and mood disorders. The Ministry of Defence conduct their own research annually. So the Continuous Attitude Survey covers everything about working life. So that goes from satisfaction with pay to if they own their own homes or if they have dependents. Looking at this survey, looking at the section to do with well-being, everything to do with life satisfaction, happiness, job satisfaction, personal morale has decreased by 10% since 2010. The Mental Health Survey, also conducted annually by the MOD, has found that within the Royal Navy alone, there has been an increase of 32% of initial assessments to do with mental illnesses. This has also stemmed that there's been an increase in the diagnoses as well. The quarterly personnel statistics has stated that there is currently a deficit of over 1,151 Royal Navy personnel. After being quite sceptical of this number, I did my own digging and found that there's a further 4,990 personnel that are unable to fully complete their job. This being either due to being medically limited with their deployability, so they are only able to sail with their ship 50 miles from the UK, or they are medically non-deployable, so they aren't able to do their deployments at all. All this research is very statistical and it doesn't have the ability to explain why this occurs. So my research aimed to understand from a personal perspective how these shortages are affecting the sailors and to understand their awareness of mental health issues and their available support. To do this, I utilised 20 current serving personnel. For this presentation I've only included 8, but I hope you will see that I've chosen these 8 for maximum variation with their rank, rate and the branch that they serve in. I conducted semi-structured interviews to allow for depth of information and analysed these using framework analysis. I tried to use a mixture of deductive, so that's my own views, my aims that I want finding, and inductive, so the respondents raised views and themes within this analysis. So firstly, my preliminary findings. When I say coded, I mean the amount of times that one theme came up within these 8 interviews. So untrained covering higher rank gaps covers whether a personnel is fully trained to do the position that they are being asked to do. This has been coded 17 times within these 8 interviews. No breaks covers whether there's breaks between deployments, breaks during the day at work or breaks after work, and this has been coded 11 times. Recruitment inconsistencies is pretty much what it says on the tin, so whether their recruitment is consistent and whether they are able to retain the people that they recruit. That was coded 9 times, and mainly within the higher ranks within the Navy. Lack of support is the only one that directly correlates to mental health, so this covers the support that they believe is available to them, what support they would access if they need to, and how they would help others access if they are of the higher rank that they are looking after the lower ranks. And this was coded 24 times within the 8 interviews I've used. So, firstly, undertrained covering higher rank gaps. If I draw your attention to participant 16 on the side there, he is a training petty officer within the Navy, so sort of 3rd rank up from the bottom, if my memory serves. And in his quote, he's stating how he was given a job that he wasn't fully trained to do. He wasn't the rank, he hadn't had the training. He carried on to say that it was a 24-hour job trying to cover the position that he was trained to do and the additional jobs he was given he wasn't trained to do, and also try and train himself to be able to use the kit that he's been given. He's a weapons engineer, so he knows that if he doesn't know his kit and doesn't have the knowledge, it could result in fatalities and loss of equipment. As you can see, it has a direct link to his well-being. He was losing sleep. Further on in his interview, he said he felt like a rabbit in headlights. He didn't know what he was doing. So no breaks. If I draw your attention to participant 7 at the bottom, she was an able rate, so lowest rank in the Royal Navy, and a communications specialist. She'd been in the Royal Navy for 3 years at this point. She had explicitly stated to her ship that she had issues with depression and anxiety. On this day that she was talking about, she said that she knew she was in a bad place and she needed some time out. She needed to be able to get away. They told her she was unable to do so because out of the 7 people that are meant to be in her sector trained to do the job, there was only 2 at the time. So the job just wouldn't have got done. Since doing her interview, she has unfortunately handed in her chit, as they call it, or her notice, and she'll be leaving the Navy within the year. So recruitment inconsistencies. As I said, this came up mainly in the higher ranks because I think they have more of a top-down look on the hierarchy. So if I draw your attention to participant 9, he's a Deputy Weapons Engineering Officer. He has only been in the Navy for 2 years, as he's been piped in as a direct entry. This means that anybody with a degree or previous experience can go in to do training and go straight in as an officer, or petty officer, killick, can go in directly at a higher rank. As you can see, he's saying that the Navy do realise that there are gapping issues, but they don't understand how to consistently fill the spaces. So as he says, warfare is brimming with people. There are plenty of people to fill the billets that are needed within that branch. But engineers, that's where the majority of the gaps are. They've turned off warfare training, which makes sense in some ways because it means that they will probably be pushed to do engineering. However, there's still going to be dropout during the few years that they turn off warfare. So this means that within, as he says, 5 years, the gaps will be an issue for them. So lack of support. As I said, this is the only one that directly relates to the mental well-being of the serving personnel. Again, if I draw your attention to participant 16. So as I said, he's a training petty officer. This means that when he goes back on ship after training, he will also be a divisional officer. This means that he will be the port of contact for quite a few lower ranked personnel. They will go to him for advice on the job or if they're struggling. As he says, he doesn't know an actual route as to how to help somebody. He'd do what he would expect from somebody else if he went to them for help. If I also draw your attention to participant 4 and 5 on the side, participant 4 is a chief. She is one above participant 16. As she says, you've got the LMA, a leading medical assistant, or a MA, which is a medical assistant. But she doesn't think they're qualified, so you'd have to go through your divisional chain. Your divisional chain is your divisional officer and higher, but your divisional officer doesn't know where they'd go for help. Participant 5 is a leading medical assistant. She says that she would struggle to find anyone she would be comfortable to go to if she had issues on a ship. She also carries on to say at the end of her interview, she doesn't feel fully clued in as to how to do her job because they are not trained in mental health. So my conclusion. As I've hopefully explained, there is a link between mental illnesses and personnel shortages, but it could be seen as a bi-directional relationship. So mental illnesses could be affecting personnel shortages, but the personnel shortages could be affecting mental illness. Other influences, such as lack of training, work and home pressures, recruitment issues, lack of resources, limited knowledge and time constraints can also influence these. This research has only been conducted on a very small division of the Royal Navy. I've only looked at surface fleet. So the results could have been different if I looked at shore establishments or the submarine service. As I said, I have no cause and effect. I can't say for definite that mental illnesses are causing personnel shortages or personnel shortages are causing mental illness. But looking further, the vast majority of previous research that's been conducted into the well-being of the Royal Navy personnel has been conducted or at least funded by the Ministry of Defence. This causes a potential conflict of interest. So I'm hoping that you can see that I'm trying not to put my own views onto these results, and I'm trying to use the experiences of the personnel to shine a light on what's actually happening. Obviously, as I said, I only looked at a very small branch, so there is further research potentials. However, not just in the Royal Navy, there's the Army, the RAF, the Marines that could all do with looking at their well-being. So I hope you can see that I've looked at the lived experiences of personnel on the front line, not just as numbers, but as individuals with experience and knowledge that could help future sailors coming through recruitment. Thanks.